Hi, Bob Boussard with the Division of Behavioral Health. You've probably heard my name before. I'm the staff support to the centralized data system. This video will be about what happens when you report a data issue and what your responsibilities are in reporting a data issue. I'll be using the term encounter often within this presentation. An encounter is defined in the CDS User's Guide as the period of time an individual is in a particular service and is the record of the progress the consumer is making toward recovery. There is an encounter for each service a person receives during the individual's tenure at an agency or location. That is, a person might have overlapping encounters for outpatient therapy and recovery support or any combination of services. Each service requires an encounter. Now that you know what an encounter is, CDS keeps track of encounters. That is the number on the Managed Encounter page in the upper left-hand corner. Anytime you talk to CDS, use the encounter as your reference point. CDS users enter information about clients into encounters, but from time to time errors are made. Most data elements can be changed or updated by the end user. That's the person who is putting in the information or staff of an agency who have permission to access the CDS. Because the division relies on the end users for its information, it is important that end users can make changes or update the records. This is especially true for times when you are updating an encounter. Updates are requested every 90 days for all encounters. During the updates, the division requests the review of all data elements of each of the consumer tabs of the CDS encounter record. The consumer tabs are along the left side of the encounter and include consumer demographics, health status, diagnosis, and the like. All encounters require continued care reviews. Additionally, continued stay reviews, CSRs, are requested for authorized services every time an authorization is requested. The CDS system will prompt users of CCRs or CSRs about 2 weeks before the review is due. That is, a reminder are sent once a week to the alerts queue beginning 2 weeks before the authorization end date or the expiration of the 90 days. Emergency and inpatient services have differing review periods due to their shorter time periods. Also, you may be asked to complete a CCR and a CSR as an encounter comes close to a reauthorization period. Users are requested to review all data elements and to update the consumer's progress in treatment, especially the national outcome measures on every review. Your supervisors, the regions, and the divisions of behavioral health rely on you to input the correct information about consumers and their progress in treatment. The division reports aggregate data to the federal government to substantiate the division's use of federal monies for mental health and substance use disorder services. Again, we rely on the input into the data system of those who are closest to the consumer. Your information is very important and requires continuous updating. As I said, most data elements can be changed by the end user. But here is a list of data elements the CDS users cannot change. These include the Social Security number. Add or remove consumer from the wait list once the form is completed and saved. Assessment forms such as the PECFAS, CAFAS, SBQR, and the like. The admission date once the encounter is admitted. The discharge date and any variables of the encounter once the discharge is completed. The variables location, service, and funding region require special attention that I'll discuss later. And the crisis response forms once saved. If at any time you have a difficulty with the CDS, you can report a data issue or call the CDS support line. The CDS support line phone number will be on the last slide of the presentation. Once again, the information provided by the CDS users is most important, and management decisions rely on your accurate information. So how do you report a data issue? The Report a Data Issue button is located on the status page. Clicking on the button will bring up a reporting form. Here is that reporting form. Note there is a narrative of what to include in the Report a Data Issue. Please detail the nature of the change required, including new values for your request. Please also give an agency contact, including phone number, in case there are questions about the request. Despite what the last sentence says, the CDS system is a HIPAA compliant, and as such, all information is transmitted securely. The CDS system now operates internal to the Department of Health and Human Services, and as such is a HIPAA compliant confidential information repository. PHI is acceptable in the Report a Data Issue window. Once you click on the Submit button in Report a Data Issue window, an alert is submitted to the administrators of the DHHS CDS. Any one of the administrators may handle your request, so please be specific. This screen shows the alert as it is posted on the administrator's webpage, and the detail of the alert described in the pop-up window. Administrators can see what change is requested. There is also a link to the originator's email address. This link is used to acknowledge to the end user that a change has been made and the nature of the change. Once administrators get the alert and the information to make changes, the administrators use the search function of CDS to find the encounter needing services. The administrators have a special window where they can make the changes necessary. Administrators use the form carefully and only when an encounter requires change. Some of the most common occurrences have been pre-programmed into the site, including removal of bad encounters, changing the admission or the discharge dates. Administrators can also change the location of an encounter, the service being performed, so long as it is a registered service, and change the region of funding. In this record, we will be changing the date of the admission. In the upper left corner of the window is a pop-up window that allows for the change in the admission date. The same is true for discharge dates. About those dates and times. At this time, CDS keeps admission and discharge dates. The CDS has the available times for the occurrence, but generally we don't make time changes, so when you change a date, the system defaults to midnight. If you want a time, be specific. Once the change is made, the history form of the encounter records a change having been made. Here we see a change having been made. Click on the View Details button to see what the change was. After the change to encounter is made, an acknowledgement is sent back to the originator through an open email system. No confidential information exchanged within this email. The acknowledgement will include the encounter number in the subject field and what was done to the encounter. In this case, we changed a date. If an administrator cannot make a change, that will be noted in the email. Change of location or change of service are difficult in CDS. As you know, services at agencies are done at a location. If a consumer cannot be served at one location and requires a location change, a new encounter is usually required. If you see a client at another location, in this case once in a blue moon, then you can use the original location to bill for the service time. However, this needs to be a rare occasion and at the convenience of either the consumer or the staff member. Let's take an example, a baseball game that both the consumer and the staff member want to attend, and another office is close to that location during a regular time for a counseling session. If the encounter is a registered service and the location has not yet been billed for an encounter, either the location or the service can be amended by administrators. Authorized services are less likely to be amended due to the nature of authorizations. In any case, if billings have occurred, no change can be made until the encounter is zeroed out on the tabs and a new encounter developed. Work with your billing offices if an encounter has previously been billed. The three data elements of provider, location, region of funding, and services are all changeable under circumstances that a billing document has not been sent, an encounter is a registered service, or a location change for an authorized services is within an agency with multiple locations having the same service and is previously unbilled. Here are the contacts for information about the CDS and the use of the Report a Data Issue button. Please start with the CDS Help Desk at Orion Healthcare Technology. If you have difficulties using the system, any one of these three people will be happy to help. And finally, to all the users of the CDS, thank you for the work you do to support recovery and for your continued accuracy in reporting the information about consumers' progress toward recovery through the CDS system. Thank you for listening. Goodbye.